My name is Tyler Ennis, and I'd like to talk to you today about motivational interviewing. Have you ever wanted to break a bad habit or start a good one and couldn't figure out why it wasn't taking? Have you sat at the doctor's office as they're giving you advice, feeling like you might want to try it but don't know how? Through the research I've done over the course of the last several weeks, I can say with certainty that you're not alone. Most people have behaviors that they aren't proud of but find difficult to stop. Motivational interviewing is a method of therapy in which healthcare providers talk to their patients as it relates to behavioral change. Motivational interviewing helps patients realize that they do, in fact, need to make a change. It's the provider's responsibility to foster a judgment-free environment in which the patient is able to reach this conclusion. This method of therapy works best when the patient is looking for a reason to change or if they are hesitant to make any major life changes. In the next few minutes, I hope to expand on these points and make it clear why this style of therapy is so helpful. Motivational interviewing is a type of therapy that requires patients to make the decision to change for themselves. This facilitates a lasting change. To paraphrase an article by Barbara Teeter, many patients struggle with finding the motivation to change their behaviors. Whether it's following a doctor's instructions or trying to overcome an addiction, when you are told what to do, sticking to a course of action is harder than when you reach that decision on your own. According to an article in the Polish Journal of Public Health from 2018, when a doctor helps their patient reach the decision to change on their own, the patient often finds their own motivation to maintain that change. This is the most important aspect of motivational interviewing. When a patient chooses to change for their own reasons in their own way, they are far more likely to stay on track. A study done by Amanda Vader, Scott Walters, and many others that was published by the American Psychological Association in 2010 showed that there is a correlation between self-motivated change talk and a reduction in alcohol consumption in college students. This group of researchers recorded motivational interviewing sessions with college students who were heavy drinkers. Those students who had a higher rate of what the researchers call change talk, a method of self-determination in which a person is open to the idea of a behavioral change, were more likely to reduce the number of alcoholic drinks they consumed in a 3 and 6 month period. On the other hand, participants who had a higher rate of what's referred to as sustained talk, essentially this is the opposite of change talk, in which the participant vocalizes no desire to change their current behavior, were less likely to reduce their level of drinking over that same 3 to 6 month period. Though it should be noted that all participants who participated in the study showed some improvement, but this was chalked up to talking to a counselor and contemplating change. While self-efficacy is the most important part of motivational interviewing, it is not the only important aspect. In order for motivational interviewing to be effective, the healthcare provider must create a judgment-free and supportive environment. There are no set rules on how to administer motivational interviewing as a therapy style. The reason for this is that each person has their own reasons for why they may want to make a change. The best way for healthcare providers to assist their patients is to follow the basic principles of motivational interviewing and remember to be flexible with the details. In the American Journal of Nursing in 2007, authors Levansky, Forkheims, O'Donoghue, and Bites wrote out a very clear guide on what these principles are. The first is to show empathy. The second is to develop a discrepancy. Basically, this means help the patient realize that there are benefits to making a change. The third is to roll with patient resistance, and the fourth is to support self-efficacy. By following these 4 basic principles, providers are able to help their patients make positive changes and maintain them. When given free rein to decide what and how they should work on changing, patients are far more likely to continue the behavioral change after their treatment has ended. In the 1992 book, Motivational Interviewing, Preparing People for Change, by Miller and Rolnick, the men who pioneered motivational interviewing as a therapy style, it was noted that patients who were treated for alcohol dependence using motivational interviewing versus those who did not receive treatment were greatly improved. This improvement was reflected in 1, 2, and even 4-year follow-up interviews. As you can see, the patients who made the decision to change on their own stuck with the decision far better than those patients who were told that they need to change by someone else. While motivational interviewing has benefits to most patients, there are some that experience more benefits than others. Motivational interviewing has been shown to be most effective in patients who are not motivated to change in the beginning of their treatment. Motivational interviewing presumes service users will commit to change when they are motivated, says Barbara Teeter in the Black Belt Companion to Social Work in 2013. When someone has experienced a traumatic event, or even if that they do not feel that they need to make a change, they can be resistant to standard methods of therapy. Patients often become defensive and even hostile toward a provider that they feel is trying to tell them the correct course of action. In the process of motivational interviewing, the provider should ask open-ended questions to try and get the patient to make a connection to something in their life that would be improved by a behavioral change. Says the author of Motivational Interviewing, an evidence-based approach helps patients follow treatment recommendations. This is where motivational interviewing comes in. Motivational interviewing's method of rolling with patient resistance helps the provider work around patient issues. Many patients who are not actively looking to change can become resistant to therapy and will become less likely to change their behavior, as previously noted by Barbara Teeter. Allowing the patient to express their concerns and talking about them with the patient helps the provider direct the patient to the best course of action for change. In conclusion, when a provider helps their patient reach the decision to make a behavioral change on their own, the patient is far more likely to keep that change. Motivational interviewing lets the patient make the decision to change on their own terms and for their own reasons. This most often leads to changes that stick. In order for motivational interviewing to be effective, the healthcare provider must foster a judgment-free and supportive environment. They must also avoid directly telling their patients what to do. A patient who is unwilling or unaware that they need to make a change will benefit most from motivational interviewing. Behaviors are hard to change, and sheer willpower enough most often isn't enough to accomplish this. Motivational interviewing unlocks the why and values of a patient and allows the patient to develop a plan they find realistic. When the principles of motivational interviewing are followed, we can create a lasting change in people's lives. Thank you for listening, and have a good day.